Hello and welcome to Sex Unwrapped, a podcast by Saving Lives UK, with myself, Tom Hayes, a Saving Lives trustee who's been living with HIV for 10 years, and Dr. Naomi Sutton, an NHS consultant and star of Channel 4's Sex Clinic.
Sex Unwrapped is a podcast exploring everything sex. Together with our guests, we'll be exploring sex, sexuality, sexual health, and sexual pleasure. Basically, everything to do with sex. So slip into something more comfortable and let's go.
We're joined today by Dr. Steve Taylor from Birmingham. He's the clinical lead for research and he's the medical director of the Saving Lives charity. We're also joined by Marcella. Marcella is a self-described 57-year-old Fruit Loop who's been married since 1989, who was diagnosed HIV positive in 1997 when she was diagnosed with HIV and AIDS, and her husband is HIV negative and has been very supportive throughout. Initially told to hide her HIV diagnosis and resulting AIDS by calling it leukemia, Marcella realised that the lying was causing more problems than the truth itself. 23 years later, and a kidney transplant later, say hello to Marcella.
I have the pleasure of introducing Pete. He's 54, lives near Birmingham, has been HIV positive since 1999, and he's under the care, which he describes himself loosely, of Dr. Steve Taylor for the entire time, and he thanks his good meds and good health, and he's been undetectable since 2002. He's also an ambassador for the Saving Lives charity. He has a size 10.5 shoe, and his star sign is Capricorn, and he's born on Boxing Day.
So the reason we've got you all here really is a article that Dr. Taylor wrote that kind of went viral at the beginning of February called HIV and COVID, a tale of two viruses. That you both talked about in the article. Steve, do you want to tell us about the article and why you wrote it and why you think it's gone so popular?
Yeah, I think that it was several things came together. One was the It's a Sin television program that was airing on Channel 4. The other was it was HIV testing week. And the final thing was I was redeployed to the ITU during the coronavirus pandemic. And whilst I was doing that job, I was doing a communications role, and I was talking to a lot of families who were unable to see their relatives, and just had a lot of resonance with what was going on in the television program, particularly with the young boy who was confined to what almost was a cell. And I just started thinking a little bit more about it, and started to think about some of the parallels that we're seeing between the early days of HIV and AIDS and the coronavirus pandemic. And that's what stimulated me to write the article.
What was it about the article you think has made it go so viral? Because it's one of the most shared things we've put on Saving Lives.
Yeah, I think that I think one of the things was being able to speak about Marcella. I mean, Marcella has only fairly recently come out about her HIV diagnosis, and it's the degree of stigma that Marcella probably has experienced during the time she's been HIV positive, and how that resonated with the early days of the HIV epidemic, where stigma was absolutely horrendous. And I think that was portrayed very well in the It's a Sin series. But also, I think that one of the things that remains today is that stigma persists. And I would say that we look after about maybe 4,000 patients in Birmingham. And I think that maybe less than 100 people are actually out about their positive diagnosis. And I think that's something that we, if at all possible, needs to be addressed.
So Marcella, what did it mean to be in that article with Steve and Pete? How did you feel when Steve approached you about writing an article and knowing that it might go as big as it has?
In a way, I was quite pleased because it was a way that I could come out. I've been so nervous to do that for a long time. And also, I just wanted people to know that you are safer now. If you go and get tested now, obviously, it's not like what I went through at all. It's so different. And I just hope more people can come out and more people will get tested from it. I found it very emotional when I read it, though, going back to them days. Sorry, I get a bit emotional now.
Oh, bless. Marcella, do
Sorry.
you feel able to tell us a bit about what it was like as a heterosexual woman, white Caucasian woman, being diagnosed all those number of years ago?
At the time of my diagnosis, I'd been in hospital about a week or so and been under, I wasn't under any HIV doctors or any infectious disease doctors. They were still stunned about what happened, what it was that was wrong with me. I was very, very ill. And then finally I was asked, would you take a HIV test? And I can remember on the top of my notes was HIV, not a candidate for, meaning, I wasn't somebody that could possibly get HIV.
Yeah.
So I had to have a counsellor who came and counselled me about the test. Then she came back to tell me about the test. And at the time, I was so grateful that I knew what it was, because I was so ill. I can remember just not being able to walk, not being able to talk properly, not being able to stand up even. It was just awful, horrendous. But I noticed that there was such a change to the way I was treated as soon as my diagnosis came out.
How did it change?
On my doors, for one thing, I always remember there was biohazard stickers right across the doors. People used to come in all full mask and gowns and frightened of catching anything. Instead of being friendly and compassionate to me, a lot of the nurses and care workers they just didn't want to speak to me at all. Sorry. Then I'm so sorry.
No,
It's all right. You can stop if you need.
When I finally got onto the infectious disease ward and saw the infectious disease doctors, it was such a difference in the way I was treated. So when I moved there, the care was so different. The staff were so understanding and kind to me, but I still felt as if I was dirty inside. If anybody came to visit me, I didn't want them to hug me or anything. Even though I knew they couldn't catch it, I just didn't know what they were really feeling. So I think that was a big thing why I hid my diagnosis for so long. And then while I was on the ward, my renal failure, my kidneys were packing up, and they said I'd have, the doctors said I'd need to go on renal dialysis. And I was waiting for the renal consultants to come down and see me. And when they came in, they wanted to discuss options with me because they didn't think I'd be able to go on a hemodialysis, because they didn't want me to go on a machine because I'd dirty the machine. Which
That's awful.
That was fine by me because I'm not very good with blood anyway or anything like that. So I went on to CAPD dialysis, which is having a catheter in my stomach and dialysing 4 times a day myself, which eventually I went on to overnight dialysis, where there's all the bag exchanges at night. And I was on that for 9 years, just over, when Dr. Taylor, who had been with me right from the start and all the way through this, taught me into having a kidney transplant, which I was a bit frightened to have, but 2006 I had that and everything went well.
It's been a hell of a journey.
Yeah, it has.
I don't think anyone who's listening to that can help but feel the emotion behind those words. And, for anybody who's going through any sort of diagnosis, any kind of medical care, needs support, don't they? And love and understanding. And I think that's what's so upsetting when it comes to HIV stigma. And I hope things are better now. But I know when I tell people, especially white heterosexual females, about HIV, they often don't ever tell a soul. Whereas if you were diagnosed with breast cancer, for example, you'd go home and everyone would go, oh, that's dreadful, and rally round. Whereas, it's a different ball game, isn't it?
Yeah, completely. Yeah. Part of me still has got a few people who I haven't told, and I think what will happen when they find out, how are they going to be? But I just think it needs to change. It really does, because it can happen to anybody. You know, it's not how people think. It's not just gay people that get it, or drug users that get it. Anybody can have it. I've never used drugs. I haven't really been that sexually active. I've always been in long-term relationships, and I managed to get it.
You only need to have sex with one person, don't you? And
Exactly.
you know, we shouldn't be judging, and it doesn't matter anyway. It doesn't matter how somebody gets an infection. It's, you know, that's life, isn't it? We make choices, and, you know, we shouldn't be stigmatized or blamed. Pete, can you tell us a bit about your, I mean, do you echo similar sort of feelings around your diagnosis?
I feel so much for Marcella because she went through so much more than I did. I would class myself as one of the luckier ones because of the time scale of things. Having been diagnosed in '99, by that time, obviously there was a lot more in the combination therapy available that were less painful, less huge side effects. It wasn't great to deal with. Of course it wasn't. It's not the outcome you want to hear, is it? But from my point of view, it was a couple of difficult years of tolerating pills that didn't want to know, you know, not being able to stand up after I'd taken certain tablets, hallucinations, bad dreams, broken sleep, tightness in the throat, and goodness, compared to Marcella, that's nothing. I mean, nothing. So I consider myself very fortunate to have accidentally gone and get my diagnosis, because it was purely by accident. I went along with a friend who was having some jabs to go to Africa. So I popped in next door to Hawthorne House and I thought, I'll have the full routine. I didn't even think of an HIV test, and the nurse suggested it. And I said, yeah, fair enough, okay. And I think it was 2 weeks with the results at that point, and it was quite a wait. And then when I went back in and got that outcome, and I mean, she was so lovely at the time. But you do, as you get your diagnosis, I can still see her face nodding sideways, and then everything just went. Don't hear a thing, don't see a thing. And just immediately, you know, you say, how long have I got? How long do you reckon? And nobody will be drawn on a timescale, which is fair enough, because at that point people were still dying, lesser so. So I knew in my head I'd probably got 2 to 5 years to sort myself out and try and get used to the regime that Dr. Taylor put me on. But yeah, compared to Marcella, this was a walk in the park, really. And
Steve, how was it dealing with, because obviously you're, you know, a little bit older than me, so I can when you know, I got the easy job of drugs and things, but what was it like with that that, I guess, that helplessness of not being able to offer enough for these people?
I think first of all, just to try and explain exactly how sick Marcella was. So she said, you know, she described to you that she couldn't walk, she couldn't talk almost. She was, she'd lost so much weight, and she was actually living in Gran Canaria at the time, and she came back. And just to say that when she came back, she had a form of pneumonia called pneumocystis pneumonia in her lungs, which it's only people with really suppressed immune systems get that. She had that. She had esophageal candida, so she had candida growing down her esophagus. She had salmonella septicemia, and she also had 2 or 3 different bowel bugs which were causing chronic diarrhea. And in addition to that, because she'd been so well, she'd gone into kidney failure. So she was so sick. If Marcella had come along maybe 3 years before that, her prognosis would have been less than 6 months. It just so happened that she was diagnosed just as we were beginning to get the new antivirals. We didn't really have the brilliant ones, but it was just at that time. And we remember that we went to try and get her admitted to ITU at that time. And at that time, they weren't really taking people with HIV because they felt it was, well, what's the point? Because there is no treatment. Therefore, are you just getting someone over? And at that time, there were quite a lot of, you know, discussions and arguments to say, you know, if we can get her over this acute phase, then there are good treatments available. And she had a pretty rough time when she first started her meds. I mean, she'll tell you about that. It took quite a bit. But I think that, you know, she has been the model patient right from day one. Absolutely amazing. And it's just that positivity and warmth that just shines through, which is just why I'm so happy that she has decided to do this, because I've always said, anybody that meets Marcella just goes, oh, she's so lovely. And because it's true. And, and I just think that, she's a very, very special woman. And I'm so glad that she made it. And is here. And now her immune system is higher than mine. Her CD4 count is higher than mine. She's been undetectable for nearly 20 years now. So it's amazing. And I wrote the article before I told her, because whoops. But I wrote the article because it reminded me of her so much, because of the ITU experience that she went through, and then feeling the ITU experience now. And it just kind of took me back to that thing. And then I asked her, I said, can I use it? And, still, this is very raw for Marcella. She's only just, talking about it now. And as you can see, she gets very, very upset about it. But I just know, or I am praying, that anybody that hears her story is going to react in a way such as, why didn't you tell us? Why didn't you tell us? Why for 20 years have you been hiding this? And I really hope that, that this is good for her. I really hope so. And, and for all of those people who are coming and sitting in the waiting room thinking they're the only one who has this in their community. And yet, that the church that they go to, there's another 20 or 30 people who have the diagnosis and haven't told anyone else because of fear of judgment. I think it's different in some ways in the gay community. And I'm sure Pete can talk about the early days, on the scene. He hasn't told you he was a DJ Dolly.
Award-winning DJ Dolly. Thank you.
But I think that It's a Sin, has been wonderful in painting the picture of what it was like for young gay people just coming out for the first time, which was a huge issue in itself. And then sort of the denial of this infection in the same way that people are denying COVID now that doesn't exist. And I think I'll hand over to Pete to tell us a little bit about his DJing days.
Once upon a time in the city. Yeah, I came out kind of early summer of '87, the actual month that the AIDS leaflet dropped on the doorstep. So that was a great start, and I used to go to the Jester or the Nightingale, quite terrified of anyone and anything, just even to talk to people. You might find it hard to believe, but I'm quite shy. I know. So I stood behind the DJ box, thought I can do that instead of talking to people. And that's why I did it. And I started sort of late '87. And I just watched the world around me, watched it change, watched people come and go. You'd see people come in looking not great with their friends, and their friends were jollying them along. They'd come in perhaps once more and look a lot more tired, worn out and drawn. And then the friends would be back in, and that group would be one less, then two less, then maybe four less. And I'd look around and you'd see missing faces that you think, I wonder what happened to him. And you don't like to ask, but eventually it did catch up with my age range, because that was kind of people that would be perhaps nearer 60 now. So I'm being 54, I'm just a little behind everyone else. But it was a strange time. I've lost count of the amount of funerals I went to, and we'd all end up jollying each other up at the end of it and having a laugh. And I have laughed my way through a funeral once. I don't quite know why. I think it was because the guy who we'd lost was so funny in life, and he did his own soundtrack as the coffin went through, the curtains closed, and there was an almighty crash. But it was sound effects that he put on to make us laugh, the final laugh, So being the gay community, we tend to take things in very good spirits anyway. But it was an awkward time because nobody wanted to talk about it, and we just kept losing people one by one. I knew of a guy that worked at the Jester, had one sexual encounter and died within 3 months, and that was the stony cold fact. I was frightened to get involved with anybody sexually, so I'm glad I was a late starter. I didn't really get a boyfriend for nearly 2 years because I was just playing records and putting my headphones on. My headphones were my condom, if you like. It stopped anything happening. And eventually, when I did get into relationships, it was much further down the line when the diagnosis came through. So I'm thankful that I had that to, the DJ box to hide in, if anything. But being a great observer of things, you watch things change around you, and it's terribly sad, terribly sad.
And how was it, so accessing the scene and seeing your friends when you yourself were diagnosed? At 99, you said you were diagnosed?
Yeah, it was a funny old time because, as I say, I wasn't expecting to go or receive any kind of diagnosis, but I was still DJing. I was working at Subway City at the time for Bill Gavin, great friend still. And I got diagnosed on the Friday and I worked on the Saturday night. And I just stood in the DJ box looking around thinking, who else? Who else has got this? Who else is not saying? I don't remember much about the night. I told him on the night and he just said, you can go if you want. And I said, no, this is a great leveler. I can play the music that I love to the people that I love. And let's just get it out of the way. And it just went, in a blink. But it was tough because you would start chatting to people or potential partners or dates, and then they kind of disappear in a couple of times. And I wondered, and then somebody came up and they said, have you got AIDS? I mean, I'm sorry to be forward. And I went, well, no, I'm HIV positive. Oh. And I said, well, it shouldn't make a difference. This is kind of early 2000s when people were still a little bit vague and in the dark about it. Mm. And there have been people that, tend to ghost you even. We probably invented the term, didn't we? But I find, maybe you found this yourself, Tom, it's eventually, because you've told such a wider circle. I worked in radio in the early 2000s at BRMB, and I was the first kind of openly gay on-air guy, and then decided to disclose my status on a chat show that one of my colleagues did, but I didn't tell her until I did it. And I just wanted to put a face to HIV, because then somebody can say, well, he's got it and he's all right. I mean, he's a bit stupid and a bit old and crackers, but he's okay. So it's a leveler for the public. I told my family, no issues. I'm so lucky, and this is why I hope my child has the same outcomes with the final few. My mum won't tell her friends, but then older people don't always necessarily need to know that we're not going to die straight away now. In the early days, I wanted to tell everyone, sorry, I might be gone soon. But now it's like, yeah, I add it in after my shoe size and and the star sign, you just say, well, it's there. It's often the second thing out of my mouth after my name, if I was on a date.
I first started accessing the scene when I was 15 in 1999, I know. And I spoke to this guy who had the biggest crush on in a Nightingale, and we got on really well, and then he started ghosting me. And I thought nothing of it until Pride 3 or 4 years ago, and I saw him in the street, and I said hello, and I was like, what happened? Because we were really good friends, and there was a sexual chemistry, blah, blah, blah. Turned out he'd just had a HIV diagnosis the weeks that we'd started talking to each other, and he completely removed himself from the gay scene entirely for about 10 years. Wow. Because he didn't know how to tell people, he didn't want it being circulated as common gossip. So he completely became a hermit for 10 years. And it's like, so many people lost years, lost time, lost opportunities, lost relationships.
No, it's and it's quite a thing even now. I found it's taken me nearly 20 years to come to terms and to find a relationship that I'm comfortable in. I always ended up meeting the same type of people from a certain group in the lower end of the sexual society, if you like, because everyone just accepted that's where they belong, that's where they're going to stay. And you have to climb up the ladder and get out of that kind of low ebb. So it's only very recently that and It's a Sin as a TV show is kind of, I was saying to Steve the other day, it's kind of been, it's took a plaster off an open wound and it's allowed it to heal. And it's taken since 2000. And finally, I'm coming to terms. I watched it and bawled my eyes out on one of the episode 3 on one of the deaths. And since then, it's like the final grey mist has cleared. I have absolute clarity and I have no problem talking about it anymore.
Steve, what do you think the parallels and difference between HIV stigma in the 80s, 90s and COVID stigma today? Because both of them are stopping people getting tested, people talking about treatment outcome. The vaccines could be equated to HIV treatment.
Yeah, I mean, so first of all, I think regarding vaccines, I get really angry with people who are so down on the vaccines and say, I'm not having the vaccine for this, that, and the other. And I think it's because we're 30 years down into the HIV/AIDS epidemic, and there has been multi-millions of pounds and research into trying to develop a vaccine, and it's been unsuccessful. And, you know, the millions and millions of people that have died because we haven't had a vaccine. And yet, you know, the miracle, you know, of having a vaccine within 12 months, you know, can save millions of people as well with COVID. And, you know, and I kind of people want to shake people. And now working on the ITU and seeing people dying on there, and some of them are COVID deniers and vaccine deniers. And I'm just thinking, if people could see what I've been seeing there, you know, perhaps they wouldn't be so, I don't know, blasé about, you know, saying, well, I'm not having that vaccine, etc., etc. Because, you know, this is a life-saving thing. I think the main difference between HIV stigma and COVID stigma is the fact that HIV is predominantly transmitted sexually. And I think that puts it into a different bracket. And people often talk about HIV now being like diabetes, but again, diabetes isn't transmitted by sex, and therefore you're not given, somehow I think people have this huge amount of guilt that somehow they're dirty because HIV is transmitted through sex. But let's face it, we're human beings, and that's what we do. You know, that is part of life. You know, so I think that's still a major problem.
It's fun. That's why
It is fun.
Pleasurable. We're all driven to have sex as human beings. So why we're all so uptight and stigmatizing about it is that's a societal cultural pressure, isn't it? That we're
So Marcella, there's a couple of things that we've talked about previously, and I think that this was a shock to me about the numbers of people that when you were diagnosed at the same time as you, but actually the other day you told me they're not there anymore.
When I first went to the clinic, because that was the one place you could be yourself, everybody knew about you, the staff were fantastic, and it was like a little clique, so everybody knew each other. And in fact, sometimes we'd go out for lunch or whatever, like once a month or something like that. And gradually, there was a few people who didn't want to take the drugs. They were really hard to take. I used to have to take them and try and stay still and not move, or because I didn't want to vomit them up and have to do it all again. So a lot of people didn't want to go on any drug regime then. They'd try alternative therapies, lots of different things. Out of all them people, I'm in touch with one now. It's just myself and another one lad who is left alive. The rest have all died.
I think that, I mean, this is the reason that It's a Sin is so important, because people get a feeling of what it was like there. I guess to me, the part that I just felt was missing was, why couldn't one of them survived? Because there are people who are still alive from the very early days. Not that many, but there are, and they've made it. And it would have been really good if they could have done a look back, if you like, remembering the times of what it was like, and then talking to perhaps some younger people now about the opportunities and how different it is. You know, Marcella's talked about her husband, you know, and yet he's negative. I mean, people just don't know. They're not aware of how things have changed. Now, when I see a new person in the clinic, you know, Pete will say, you know, and Tom said how shocked they were. Luckily, they've seen the health advisor before and the nurse before, which holds them when they're first diagnosed, because all they're terrified about is they're going to die. And the first thing I say to them is, look, I'm going to be looking after you for years and years, 20 years plus. You can listen to whatever you want to, or don't listen to anything else I'm going to say, but you're going to be fine. You know, we're going to get you sorted on medications, and then you'll be able to have have children. You'll be able to have sex without the fear of infecting your partners. Life can be very normal. And people people don't realize that. I mean, how many people know about this U equals U, this undetectable equals untransmittable? So many people don't know that. If you take your pills well, if you get your virus levels down to undetectable levels, you cannot transmit it. I mean, that's just phenomenal. It's huge progress. And I guess that it's a sin. We had part one, which was how terrible it was. But why don't we get the reasons to get tested? There is no reasons now not to get tested. You can save your life. You can have kids. You can have relationships. You can stop, passing it on to anybody else. There are no reasons for not getting tested. And we come back in a full circle. It comes down to stigma still. I think that the reason that people don't get tested is this fear of being judged. And this is particularly true in, the Black and ethnic minority groups who somehow don't think that HIV is a condition that can affect them. Coming back to Marcella, I just wanted to say thank you for coming out. And because if you can, then anybody can. If your story just convinces one or two more people that wouldn't think of getting a test to get a test, that saved their lives. And it's so important. So thank you for that.
No, thank you for all you've done for me all the way through it. And having said that, my family are strict Irish Catholics. I was brought up, I was quite naive. I didn't know much about sex at all. I've always been in long-term relationships, so I haven't had many sexual partners at all. But my family was so supportive of me. And in fact, I had the priest coming to see me. Well, he came to see me to give me the last rites, thinking I was going to die anyway. But I mean, my mum, it went like straight, being Irish, it went straight through the Irish, knock prayers from all over the place for me. So everybody knew and they've all accepted me. It was just in the back of my mind, that stigma, because of being told that by one nurse, to say it was leukemia. And that is my biggest regret, that I haven't come out sooner. Because if I could just persuade one person to have a test, well, that'd just be amazing.
So I think it'd be really helpful for those people watching and listening is to tell us where you are now with your HIV. It's 2021. You're still under the care of the wonderful Dr. Taylor here, who I'm sure is making sure you're being well looked after. Pete, what does your HIV care look like in 2021, thinking back to when you started?
Dr. Taylor, my longest relationship to date. I've watched him go grey. Sorry, Steve. Yeah, well, I mean, now it's a lot different. Ever since the U equals U came along, that was the game changer. And you could actually say to people up front, you'd have that conversation. Look, here's my meds. Take them every day religiously. Never missed a dose in 18 years. And there's just not going to be an issue anymore. And as long as you can understand that, then we're okay. Fortunately, I'm now with somebody who understands this anyway, happens to be positive too, but totally gets it. And you don't have to explain anything. And it's just brilliant. So it's that kind of comfort that has perhaps, and with the PrEP coming on board to assist with anyone that might have been exposed to it, it kind of covers off every little angle that was an open door before. There is, no cure, but there is medication that will lead to a better quality of life long term. And I'm living my best life now. This is just, it's never been better. The last couple of years, things have just settled. I've had the best lockdown. Sorry.
Really pleased for you. Marcella, what's your HIV care and treatment look now in 2021? So that's 24 years later almost?
Yeah, so different to what it was then. I mean, I don't take hardly any tablets now for my HIV. I think it's just 3 tablets a day I take now, and that's it. Whereas before it was like, I can't even count how many it was. And it seemed to be some you had to eat with, some you couldn't eat with. Oh, it was terrible then, but now it's just so easy. I don't even think about it half the time. It's just I just get on with my life the same as everybody else. It's just like taking a couple of tablets in the morning, and that's it. just have a completely normal life.
I think
In
that's
fact-
really good for people to hear, is that, you know, I think obviously in It's a Sin there wasn't really any medication, but we've come so far, we've come full circle. You know, lots of tablets now, just one a day, keep you undetectable. You can't pass it on to sexual partners, and ultimately we can end this epidemic, can't we? If we get everybody diagnosed and on treatment, that will be the end of it. I mean, wouldn't that, you know, if we could get rid of HIV fully, that would be a huge success story.
The only way that we're going to do that is by getting everybody tested.
Yeah.
You know, that's what we need. You know, every time you know, if you have a blood test at your GP practice and you've never had an HIV test, they should do an HIV test and test for bloodborne viruses. If you go into hospital and you have a blood test, you should be tested for HIV and bloodborne viruses. Only in that way, where we're not having to ask questions about risk factors, etc. Can we just completely normalize this and get everybody tested and get everybody on treatment? And that way we can stop the transmission of HIV.
And there's huge advances with testing in antenatal care. So, you know, at least that's now blanket testing. So I don't see why it can't be done in other places. I know some haematology places do it blanket testing, but, you know, if we could make testing much more routine, and, you know, Steve, I don't know if you feel, I mean, I meet medical professionals who are still vaguely stigmatized or worried about addressing testing people. So I think we have a long way to go as medical professionals to be able to talk about it openly and not feel that you're going to upset somebody by suggesting the test.
We just need to get over ourselves, and we just need to say, we're going to do a whole lot of blood tests, you know, and that would include bloodborne viruses. You know, that's it.
Yeah.
That's all we need to say. Because if you do a test and you find somebody that's positive, you've saved their life.
If there are any patients listening, I think a lot of patients feel, oh, I've had bloods done. And I think patients think we test for everything anyway. But I think unless you've specifically been told you've been tested for HIV, it's worth asking, and it's worth saying, can I have a test?
Right, before we end for today, I wanted to ask Pete and Marcella, if you could say one thing to someone who's just been diagnosed, what would it be?
Your life doesn't end here. Your life actually starts, because you know where you stand, you have a clear idea of where things are going, and there is no negative outcome.
Thank you. Marcella?
Probably echo what he says and just say, don't be scared, because you've just got fantastic support. And just if you take your medications regularly, well, you just get on with it and you'll be fine. You'll be fine. There's nothing to be frightened of now. It's not like it used to be, and it's not a death sentence.
Thank you. So thank you to our guests, Dr. Steve Taylor, Peter and Marcella. Thank you for coming on so much. And if you have anything you want us to link to social media, etc., we'll put it in the podcast description.
So that's today's show. Thank you for listening to Sex Unwrapped, a podcast by Saving Lives UK. Please remember to subscribe to us on Apple Podcasts or Spotify, SoundCloud, or wherever you get your podcasts.
Saving Lives is a UK charity committed to improving the sexual health of the nation. To find out more about Saving Lives UK and to find out where you can get a sexual health or HIV test, head to savinglivesuk.com.